Welcome to ATS Critical Care LitBits. I'm PJ Tiberio, a member of the ATS Critical Care Assembly and core faculty member for the Pulmonary and Critical Care Fellowship Program at Allegheny Health Network in Pittsburgh. And today we are reviewing the PREOXI trial, a landmark study in airway management published in the New England Journal of Medicine in 2024. This trial was designed to answer the question, in critically ill adults undergoing emergent intubation, does preoxygenation with non-invasive ventilation reduce the rate of hypoxemia during intubation compared to a standard oxygen mask? This study was a multi-center, unblinded, randomized, pragmatic trial that enrolled 1,301 critically ill patients across 24 emergency departments and intensive care units in the United States. Patients were randomized to undergo either non-invasive ventilation or an oxygen mask as means of preoxygenation prior to induction for a minimum time of 3 minutes. For patients in the non-invasive ventilation group, they had to have a minimum EPAP of 5, a minimum IPAP of 10 at 100% FiO2. For the oxygen mask group, patients could receive either a non-rebreather or bag mask without ventilation, but the flow rate had to be 15 liters. The primary outcome was the rate of hypoxemia defined by SpO2, less than 85% from time of induction until 2 minutes after intubation. Patients randomized to non-invasive ventilation had significantly lower rates of hypoxemia at 9.1% compared to the oxygen mask group, with a rate of 18.5%. Importantly, aspiration rates were statistically similar between the groups. I should note that those at highest risk for aspiration were excluded from this trial. The benefit of non-invasive ventilation was observed consistently across all pre-specified subgroups, including obese patients and those intubated for indications other than acute hypoxemic respiratory failure. This trial provides the strongest evidence to date supporting the use of positive pressure as a measure of preoxygenation. Physiologically, non-invasive ventilation works by recruiting collapsed alveoli and preventing rapid atelectasis that develops during the apneic period, thereby increasing the safe apnea time. So, what's the practice-changing takeaway? PREOXI demonstrates that non-invasive ventilation significantly improves peri-intubation patient safety by reducing hypoxemia without increasing the risk of aspiration among select patients. So we should be considering this in patients who are most at risk for peri-intubation hypoxemia, such as those that are obese or have very severe pre-intubation hypoxemia. So that's PREOXI, strong, high-impact evidence for critical care. Thanks for listening, and follow ATS Critical Care Assembly for more LitBits.